Hello everyone, I'm excited to be here. I want to showcase to you how artificial intelligence can be used to save people's lives. I'm Wisdom and I'm representing a team that has been working on two artificial intelligence diagnosis systems. I'm going to focus on the first one. Artificial intelligence has evidently changed a lot of aspects in our lives. We have seen this in self-driving cars, face and speech recognition, and even in health applications which involve cancer and diabetes diagnosis. So what is AI or what is artificial intelligence? Artificial intelligence involves the development of computer applications which simulate human behavior. So it's kind of a brain in a way. This is currently the cutting edge technology for diagnosis in the medical industry due to its high degree of accuracy. So we managed to come up with the COVID-19 induced pneumonia diagnosis system. The problem statement the radiologists are able to diagnose lung and respiratory diseases by just looking at radiographic signs on patients' chest X-ray. But now the new key challenge has been on how to classify between regular pneumonia and COVID-19 induced pneumonia. So study has revealed that poor diagnostic performance has been attributed to the fact that many radiologists are just seeing COVID-19 pneumonia cases for the very first time. And radiologists now need more cases and time to learn both the common and unique images features of this new disease. But by use of artificial intelligence and machine learning techniques, we can dramatically improve the accuracy of diagnosis by up to 98%. The proposed solution we developed an artificial intelligence algorithm to differentiate between COVID-19 pneumonia and non-COVID-19 pneumonia on chest abnormalities. So our aim is to help radiologists with tools in this COVID pandemic as more and more cases of pneumonia are coming up which require rapid and accurate diagnosis. Technical prototype. CAD-X is short for computer-assisted diagnosis, as we are having the diagnosis assisted by the computer. So the model, the machine learning model, is trained by using thousands of chest X-ray images, which are from normal health patients. The other ones are from pneumonia patients, and the other ones are from confirmed COVID-19 cases. So these datasets, these images, we took them from the Kaggle dataset, which and these images are images from diagnosed, confirmed images by physicians and scientists. By computer vision now, the model will be able to visualize, learn, study patterns, and extract features from these images using neural networks. So the model will be able to predict new images by virtue of it being trained on a lot of images. So it will be having those patterns. It will be having the familiarity and exposure on the patterns of certain aspects and features on COVID chest X-rays, pneumonia chest X-rays, and normal chest X-rays. So it will be able to give a prediction on any new image fed into it, and the accuracy now is actually a very high accuracy which can reach up to 98.88%. In model evaluation, the goal is to achieve model generalization by fine-tuning it. Generalization is the ability of the deep learning model to perform well on images it hasn't seen before. This is where the real-world application of machine learning is, in the ability of it being able to give a prediction on any new image. So type 2 error is a false negative error, whereby a person is said to be negative, whereas he or she is actually positive. So the model will be trying to avoid this error at all costs. And how reliable is this system in terms of cost and requirements? This system can be very useful in our developing countries, as there's already a shortage of radiologists and COVID-19 test kits. And as far as hardware requirements are concerned, no, not much is needed, as many hospitals already have extra machines and laptops. We're just utilizing what is already there. Our goal then is to further push our systems to the next level to achieve practical implementation and deployment in the medical industry to save people's lives using machine learning techniques. So our vision is to empower radiologists with tooling and the efficient systems which can increase a rapid diagnosis without compromising the quality of care. So I'm going to show you the Jupyter representation, which was responsible for making up the system. So there are a lot of libraries which are involved in building an AI system. So that is the power of Python programming language, which we were using. It has got a lot of artificial intelligence libraries. The first one which we imported being TensorFlow. So TensorFlow is the one which converts the raw data, the raw image, X-ray image data into tensors, which are numbers, because a computer cannot read raw data, it can read numbers. So tensor is responsible for that, for turning the raw data into tensors. And sklearn is the one responsible for classifying images. So the classification of the chest X-ray into COVID-induced pneumonia and into normal pneumonia. sklearn is the one responsible for that. So this is the representation. You can actually, this is the training process. You can actually see the images, chest X-ray images, which we used in training the model. So down there, there is what we call the confusion matrix. On the consolidated model test report, on the far left, there's a confusion matrix. This is the visual impression of the correctly classified images and the misclassified images. So the correctly classified images are on the far left at top. You can see there were 256 correctly classified images, and the bottom right there were 263. And now we get these two sections, and we have this false negative. The false positive is 21, and the false positive is a bit okay, but the false negative of 10 misclassified images is the one the machine learning model will be trying to avoid at all costs. So for this one, there was a precision of 0.9634, which is 96.34%. So we are going to further fine-tune the model so that it can be as accurate as possible, and it can reduce the false negatively misclassified images. So we're going to apply what we call transfer learning, which is the use of a previously tasked machine learning model. So we're going to merge it with our machine learning model so that it can have more generalization and more accuracy. So after transfer learning, we had another consolidated model test report with an improved false negative rate. So you can actually see that now a false negative misclassified images were 3. On the previous section we had 10. So the precision is risen up to 0.988, which is 98.88%. So now the data set, the images which we used in training our machine learning model are on kaggle.com. So this is the link here. There is a lot of images here, a lot, 5,800 images, and is actually 1.2 gig of data, of imaging data. So you can actually see that the model has been trained with a lot of images so that it can be as accurate as possible. So this is the COVID-19 prediction system that we developed. Here it is. Is AI-based chest X-ray analysis for COVID-19. It was implemented by Keras and TensorFlow. These are Python artificial intelligence libraries. So this is where you have to select your image. So you select your image. So the imaging format, you can see they are JPEGs. So the machine learning model only accepts JPEGs and PNGs. So let's test this one and see its result. There it is. So you click on diagnose. Yeah, there the result pops up. So you can actually see that this is a positive COVID positive patient. So if you were to try, let's try another image in this COVID negative section and see if it's actually COVID negative. So let's diagnose this chest X-ray. So you can actually see before you have diagnosed that there are less nodules and mist within the lungs. So I would expect this one to be COVID negative. Yeah, this one is actually COVID negative. So this is the artificial intelligence based chest X-ray analysis for COVID-19 that we were able to develop, so that we can help in diagnosis. We can help the radiologist in regions where the human eye cannot see. So the machine learning model will be able to draw boundaries on region of very close limits. So that is the power of artificial intelligence. So this is the system, and we hope to implement and deploy it in the medical industry, so that we can help with speedy and efficient diagnosis of patients. Thank you very much for your time.